Today marks a milestone for the IQ podcast. We have just finished season 1 and are celebrating the end of this inaugural season, all 19 episodes that came before this one, with a recap. So join me today on the IQ podcast when I'm going to be recapping all 19 episodes, what their topics were, their highlights, and the guests. So you don't want to miss this one because it is a summary of all the good, juicy information you can find out to raise your IQ. Stay tuned.
Hello, everyone. It's Dr. Rani Banik, America's integrative ophthalmologist, and today is a very special episode of the IQ podcast. I don't have a guest with me. It's going to be just me. But what I wanted to do is to celebrate the end of our first season together. Yes, we have already done one season of the IQ podcast. We've had 19 episodes. This is number 20, but 19 episodes chock full of important information to help you gain insights into your eye health and your brain health and to raise your IQ. And actually, not just vision and brain health. I've had some guests come on this season who've really talked about whole body health, overall wellness. And so what I wanted to do today is to do a recap of all the entire season's episodes. Yes, we're going to go through all 19 episodes, but don't worry, I'm going to keep it brief. What I want to do is I'm going to share with you where you can find all these episodes. If you're interested in a particular topic and you happen to miss that week, you didn't get the email, you didn't get the notification, you can find them all. So what I wanted to do is show you how to find all of these episodes. It's very simple. All you need to do is to go to my website. So you're going to put in drranibanik.com. So on the top here, you'll see that there are the tabs. You're going to go to resources, and the first tab under resources is the IQ podcast. So you're going to click on that, and this is what you'll see. And if you scroll down, you will be able to see all the episodes, and I'll go through again what each of them are and highlight them. But this is episode 1. This is my very first episode on the IQ podcast. And I talked about the topic that's most near and dear to my heart, which is ocular nutrition. So I shared with you in this podcast my top tips on how to eat right to support your vision. And a lot of these tips are from my book, Beyond Carrots, Best Foods for Eye Health A to Z. But these are actionable strategies. So simple things that you can do, you and your family can do to help support your vision. And these are kind of overarching principles. And again, they don't just help your eye health. A lot of these nutritional guidelines will help you with your brain health, your cognition, help to reduce inflammation in your body, help with cardiometabolic health, immune system health, gut health. It all is it's all encompassing kind of these nutritional principles. They will help your whole body health. So please check out this episode, Eye on Nutrition. I do share a slideshow in this episode. So if you are typically listening to the podcast, you probably want to switch over to the video format so you can watch the slides because and I highlight some amazing foods. And so you don't want to miss those. Okay. That was episode 1. Now, I'm just scrolling here on the bottom. You can see that all the episodes pop up if you just scroll through here. Episode number 2, I had a guest who is my colleague for many years at New York Eye and Ear. He's an amazing retina surgeon. He is world renowned. He's done so much groundbreaking research in retinal disorders. And what we did in this episode, Dr. Richard Rosen was my guest, by the way. We talked about eye stroke. And, eye stroke is a general term, but there are different types of eye strokes. There can be retinal strokes, there can be optic nerve strokes. So Dr. Rosen and I discussed various types of retinal strokes, including retinal artery occlusion, or RAO. Some people may know it as central retinal artery occlusion or branch retinal artery occlusion, but usually it causes severe, irreversible vision loss. But in this episode, Dr. Rosen shared some of the really cutting edge technologies that we're using at New York Eye and Ear and Mount Sinai, which is where I practice as well, on how to deal with these conditions when they are acute. So yes, there are treatments available, but patients have to come in acutely. So you learn more about eye strokes in episode number 2. Moving on to episode number 3. This was another solo episode of mine talking about another one of my favorite topics, which is migraine. So this episode 3, is called Eye on Headache. And I talk about what is migraine? How is it different from a regular headache, like a tension headache that many of us get on occasion? Migraine is a very unique entity. It is not just a regular headache, it's a neurologic condition. So in this episode, I go over what some of the common symptoms may be. And then this is really important. If you or someone you know or love suffers from headaches, you want to get the diagnosis right. So I talk about the diagnostic criteria for migraine. There are very, very specific diagnostic criteria. So you can get them all here. And I also happen to mention in this episode a lot of the visual symptoms of migraine, which are so many. It's not just, one classic type of symptom. People can get a range of symptoms. So you can learn more about that in episode number 3. Moving on to episode number 4, another special guest of mine who is also a colleague and a friend, Dr. Dana Cohen. She's an integrative and functional primary care provider, also based in New York City. I've known Dr. Cohen for quite a few years now. We met at a conference back in, I think, 2018, and we've stayed in touch. We always bounce ideas off of each other and share patients. But Dr. Cohen is the author of this book right here called Quench. This is her first book where she talks about proper hydration and the power of hydration and how to get proper hydration. And then she also mentioned her second book, which has just come out this year in 2024, called Fuel Up, where she shares a lot of recipes. They're simple recipes that you can make with a blender and stay very well hydrated, and other, amazing nutrients in those recipes as well. So definitely check that one out. Episode number 4, Eye on Hydration, How Much Water is Enough? Okay, so now I'm going to scroll down here, moving on to episode number 5. Back to the topic of migraine. Yes, again, one of my favorite topics. And in episode number 5, again, this is a solo episode. It's called Eye on Migraine, 5 Tips to Manage Migraine Naturally. Yes, naturally. And in this episode, I share basically what I went through with my migraine journey, which began as episodic migraine and then became chronic migraine, basically chronic daily migraine for years and years and years, until I made some major changes in my life. I made major changes with respect to my nutrition and also my lifestyle choices. For example, my sleep, my stress levels, my living environment. I was exposed to a lot of toxins in my living environment. So in this episode, I share my story, what I did to finally get better and to break free of chronic migraine, and also not be so dependent on migraine medications, which I think a lot of people unfortunately are. They rely on them, which of course they're helpful, but ideally you don't necessarily want to be relying on prescription medications all the time. You want to try to treat migraine from where it's coming from, not just put a Band-Aid on it. So try to treat it at its root cause. And this is what I share in this episode, 5 tips to manage migraine naturally. Moving on to episode number 6. Here I had another wonderful guest, Dr. Nisha Chadha, who, by the way, just won an award, Woman in Ophthalmology Award nationally. So she's very well recognized around the country for what she does as a glaucoma specialist and as an educator, and also as a mentor for women who are in the field of ophthalmology. And so Dr. Chadha talked about glaucoma. And in the episode, we discussed, what is glaucoma? What are some of the symptoms? What are some of the signs that we look for on an exam? And what are some of the ways we treat it? She talked about also compliance with therapy, because I know some patients, they have trouble getting their drops in or, using them regularly. They forget. She talked about a technique called motivational interviewing. So if you are an eye care provider and you listen to the IQ podcast, first of all, thank you. Thank you for joining me in this journey. But she talked about some great tips for motivational interviewing that you can use on your patients to help understand, what are the obstacles to perhaps using some of these drop regimens, and what can we do as providers to help our patients be get their drops in on time and regularly. So that was episode 6. Episode 7, Eye on AI in ophthalmology. AI, as we all probably know by now, is artificial intelligence. And I interviewed my chairman at Mount Sinai, who is Dr. James Tsai. He's also a glaucoma specialist, by the way, but his new interest is in artificial intelligence and how it can be used to elevate the field of ophthalmology and eye care, and also improve access to care and get more accurate diagnoses in patients who may not have regular access to eye care providers. So he talked about the new center at Mount Sinai. I'm probably going to say this wrong, but I think it's called the Center for Ophthalmic Artificial Intelligence and Human Health. I hope I got that right. It's a long title, but basically Dr. Tsai shared with us some of the research projects that are going on using artificial intelligence to enhance patient care and make things more efficient. So I think, again, if you're an eye care provider, you happen to be listening to the IQ podcast, you definitely want to tune into this episode, because Dr. Tsai shared with us kind of the future of how AI will be affecting our field and how we should really embrace artificial intelligence rather than shy away from it. It's not going to steal our careers and our jobs. It's far from that, but it can really make us more effective care providers in ophthalmology and optometry. So now, episode 8. On this episode, I invited another colleague and friend. I happen to have a lot of colleagues and friends in the healthcare space. This is an episode where I interviewed Ashley Koff. Ashley is a registered dietitian. She has her own business on nutrition, helping other dietitians and nutritionists understand treatment plans for their patients and clients. But Ashley is an amazing human being. She is so always ahead of the game when it comes to new technologies. And so she really understands the nuances of nutrition and at a biological and cellular level. So Ashley talked about GLP-1 receptor agonists, the drugs, but also how our body naturally has some of these proteins that are GLP-1 compounds. And so she talked about, how do you kind of optimize GLP-1? How should we be understanding our body's response to certain foods? And so again, in the era of these GLP-1 receptor agonist drugs kind of taking over the market across the world to help people with weight loss, but also help manage their diabetes better, their cholesterol levels better. Ashley did a great review here of natural GLP-1. By the way, she has a book coming out. I think it's going to be coming out either in 2025 or 2026. So maybe I'll have her back again once her book is out to help educate us on how to boost up our GLP-1 levels naturally using other methods. Now, episode number 9. This was another solo episode. So if you see a pattern here, about every other episode, I've been doing some solo episodes. But here I talked about a condition that I see fairly often as a neuro-ophthalmologist. And this condition is thyroid eye disease, also known as TED. And in thyroid eye disease, the body creates antibodies against the thyroid, which then cross-react with receptors in the eye socket, in the fat of the eye socket, some of the other tissues in the eye socket that cause certain eye symptoms like bulging forward of the eyes, dry eyes, swelling of the eyelids, eyelid changes, sometimes even in the worst case scenario, double vision or vision loss from swelling and congestion and compression of the optic nerve. So in this episode, I explain about thyroid eye disease, what it is, what thyroid conditions it can be related to, whether it's Graves' disease or Hashimoto's, which are both autoimmune thyroid conditions. And then I talk about what some of the symptoms and signs are. So again, whether you're a patient and you may have some of these symptoms, it's good for you to know. And again, this is a slideshow episode. So if you're listening to the IQ podcast, I strongly, strongly suggest you switch over to the video on YouTube, and all the links are here. So if you just click on any of these episodes, you can just click read more. It will take you to the audio, but also the video link to watch these episodes. And of course, if you click into any of the episodes, you will get some of the timestamps. So let's say you wanted to hear just specifically about, one particular question or issue being answered. You can go ahead to that timestamp. So, and there's lots of great resources that are here as well for myself and for some of the guests that I've interviewed. So definitely check that out. So that was episode 9 on thyroid eye disease. Now, episode 10, this is kind of a tag team approach I did here. And this episode, I interviewed, again, another friend and colleague, Dr. Eric Ozansky. He is a chiropractor by training, but he's also a functional medicine practitioner. And Dr. Eric is very, very well known in the thyroid space, helping patients with both Graves' disease and Hashimoto. So if you happen to have either of those autoimmune conditions, definitely tune into this podcast and maybe follow Dr. Eric as well. He has his own podcast called Save My Thyroid. And so he's got some amazing information there. He's helped thousands and thousands of people with his approaches. But basically, we talked about natural approaches to thyroid conditions, whereas I know a lot of people may be recommended to take medications or perhaps even do surgery to remove the thyroid. Dr. Ozansky shares some really important nuggets that have to do with functional medicine approaches to thyroid conditions. So definitely check that episode out, episode 10. Now, we are moving right along here. We're up to episode 11. And here, so this, I did something really interesting in this episode. I talked about migraine, but I actually didn't talk about it. I had two of my colleagues talk about it. They have their own podcast, Mark and Christine. They have their own podcast called the Health Compass Podcast, where they talk about a variety of different health topics. And so they shared a PDF that I had written about the visual symptoms in migraine. So they went into the details on that, on the 5 different types of visual symptoms in migraine. So definitely check that out. It's really a fun conversation to listen to between Mark and Christine, but they talked about visual aura, which are flashing lights that people can get from migraine. They talked about light sensitivity, sometimes pupil changes in migraine or droopy eyelids. So some really useful information there. If you have migraine or if you know someone who does, a friend, a family member, a neighbor, a coworker, please share this with them. And in this episode also, if you click the read more, you can download that PDF that I was mentioning earlier. So now we're up to episode 12. In this episode, I interviewed someone who's a celebrity, Ocean Robbins. He is the grandson of the Baskin Robbins ice cream chain founder. And he really has followed in his father's footsteps, John Robbins, and really embraced a plant-based lifestyle, a whole foods plant-based lifestyle. But in this episode, Ocean and I talk about food choices. And, if you're confused, there are so many diets out there, whether it's keto or paleo or carnivore or plant-based or vegan, vegetarian. What are some of those definitions? And Ocean shared with me kind of his journey, his family story, but then also his journey towards helping to raise awareness of this type of lifestyle and its many, many health benefits. So definitely tune into this episode. Ocean also has a new book on plants. You'll be able to see his book. It's available on Amazon. It's already hit bestseller status. Now, next, episode 13. I interviewed another colleague and friend, Dr. Kira Manousis. I've known Dr. Manousis for, oh my goodness, about 12, 13 years now. We used to work side by side at the New York Eye and Ear Infirmary of Mount Sinai. And she is really an expert in cataracts and cornea. And she's such a skilled surgeon. I mean, it's unbelievable watching her operate. If I ever needed cataract surgery, I would go to Dr. Manousis. But before going to cataract surgery, Dr. Manousis and I talk about, basic things about cataracts. What is a cataract? How can it impact your vision? What are some options? If you're having some vision challenges because of cataracts, what are some things you can consider? So it's really a wonderful overview of cataracts. Now, we don't talk too much about techniques like cataract surgery techniques, etc. That'll probably be in a future episode. But in this episode, again, Dr. Manousis goes through very, very comprehensively, like what is a cataract? What can you do for it? And Yeah, it's part of natural aging. So don't be scared if you've been diagnosed with a cataract. It happens to all of us, even eye doctors. It happens to. She really breaks down a lot of myths about cataracts in that episode. Okay, now moving on to episode 14. This was another solo episode I did. And in this episode, this is called Eye on Ocular Myasthenia Gravis. So myasthenia gravis is an autoimmune condition where the body makes antibodies against the connection between nerves and muscles. And because of antibodies being made against the nerve and the muscle connection, muscles don't work properly. So people experience weakness. And one of the very first symptoms of myasthenia in general is eye symptoms like a droopy eyelid or even double vision. And the thing with ocular myasthenia is that it comes and goes. So patients may not have the same symptoms all the time. It may be fluctuating. So in this episode, I go through what is ocular myasthenia gravis, and what are some of the triggering factors, what are some underlying root causes, and what are some of the symptoms? Because some patients may have myasthenia but not know what's causing their symptoms. So it's really, really important to understand, okay, what are some of the symptoms to watch out for, particularly if you're someone who has a history of autoimmune conditions, whether it be thyroid eye disease, because myasthenia and thyroid go hand in hand, or perhaps it's something else like lupus or Sjogren's or multiple sclerosis. These are all autoimmune conditions. Autoimmune conditions go hand in hand. So if you have one, your risk of having another one is much, much higher. So again, I explain about ocular myasthenia. There's generalized myasthenia as well. I touch upon that, but I really focus on the ocular findings. And again, this is a slideshow that I presented in this podcast. So be sure to watch the YouTube version because you'll get the most out of it. It's very, very visual. So moving on the topic of myasthenia, episode 15 is called Eye on Myasthenia. And in this episode, I interview a patient who happens to be a friend as well. And Nithika Chopra is this phenomenal individual. She is a patient advocate. She is an entrepreneur in the health and wellness space. Nithika came to me with a diagnosis of ocular myasthenia. She was really, really struggling a few years ago with droopy eyelids and double vision. And I helped her on her journey, first with the diagnosis, then with medications. And now she's doing really, really well, having been able to wean off certain medications. So I'm so proud of Nithika for her resilience and her perseverance with this condition. But I think it's really important for people to hear her story because having gone through what she's gone through during most of her life, she began with a diagnosis of an autoimmune condition when she was a teenager, and she was bedridden for a very, very long period of time. And over the years, her body has evolved, her autoimmune conditions have evolved. So she shared with us how she has managed dealing with those various different health issues. And she always seems to come out smiling and on top. So it's really wonderful to hear her inspirational story of perseverance and resilience. So definitely check it out. If you perhaps don't have an autoimmune condition, but you know someone who does, this is a great episode to share with them. Episode 15, Eye on Myasthenia, a patient's perspective with Nithika Chopra. Episode 16, Eye on NAION, which is, for any of you who are interested to know what that stands for, non-arteritic anterior ischemic optic neuropathy. Say that 5 times. I always challenge my family to say that. Non-arteritic anterior ischemic optic neuropathy. Very, very fast, 5 times. It's challenging, but you can do it. What it is basically a stroke. I talked earlier about retinal strokes in episode 2 with Dr. Rosen. This is a different type of stroke. This is a stroke to the optic nerve. And so it's an optic nerve stroke. It happened to, now this guest of mine is a true celebrity. He's a very well-known New York Times journalist. He's written many, many best-selling books, Frank Bruni. So Frank was kind enough to come on my podcast. I know he's got a super busy schedule. He's now a professor at Duke University, but he was my patient when he lived in New York, and he still is my patient, even though he doesn't live here anymore. And he talked about his journey with vision loss from this type of optic nerve stroke. It's pretty rare, but if it happens, it can be devastating. So he talked about what he's been through, getting used to adapting to using one eye, and how it's impacted his life and his outlook, and how he wrote his book about it, Beauty of Dusk. And also, he talked about what it's like being a patient in a clinical trial, because Frank was kind enough to be a patient in 2 clinical trials that I was running on this type of optic nerve stroke. And so he talked about, his experiences being a patient, the uncertainty of it all, and not knowing if you're in the treatment group or the placebo group. So it was challenging at that time, but he's come out doing really, really well from his initial diagnosis. And again, this is another truly inspirational story that I wanted to share on the podcast. Episode 17, I invited Dr. Masako Chen, who's also a cornea specialist at New York Eye and Ear. She runs the comprehensive eye clinic at New York Eye and Ear, and she's also involved in resident education. Dr. Chen is a really amazing, well-rounded cornea specialist. She does research as well. So we talked about dry eye. Eye on Dry Eye is the name of that episode. And Dr. Chen kind of explained what are the symptoms of dry eye. Most of us experience it at some point in our lives, whether you're young or old. Everyone can have dry eye. Even little kids can get dry eye sometimes, especially kids who are on screens for prolonged periods of time. But Dr. Chen explained about dry eye and some of the interesting research she's doing on diagnosing dry eye and understanding what its root causes are so that we can treat it better. Understanding, whether dry eye is because of meibomian gland dysfunction, which are the tiny little oil glands in our eyelids that secrete oils, or if it's from inflammation, because the treatment modalities can be different. Episode 18 is Eye on Optometry. Now, in this episode, I invited Dr. Jennifer Tsai, who's an optometrist extraordinaire. She's also an entrepreneur. She has her own private practice based here in New York City, but Dr. Tsai really has a very unique approach to approaching eye care. She creates a patient experience that will forever be remembered, because it's really like you're being treated like a VIP. So she has a dry eye regimen that she uses for her patients. And she also does a lot on social media educating about eye care. So is a great exchange. We talked about, Dr. Tsai and I talked about the differences between ophthalmology and optometry, how these two fields are similar, yet they're different, and how we can both work together despite being 2 different types of eye doctors. So we talked about that as well in the podcast. So Eye on Optometry, don't miss it. Dr. Jen is an amazing source of information. So follow her also on social media, on Instagram or TikTok, if you don't yet follow her. Finally, episode 19, Eye on Essential Oils. Now remember, said earlier that my podcast is not just about vision health and brain health. It's about whole body health, about holistic health, which can then impact and improve your vision health as well. But I invited, for this episode on essential oils, I invited an essential oils expert, Jody Cohen, who's also founder of Vibrant Blue Oils, these amazing essential oil blends that are designed to activate your parasympathetic system and calm your sympathetic nervous system. So it's really very beautiful, relaxing way to use these essential oils. Jody talked about pressure points and oil, great places to put oils. For example, the back of the ear is a wonderful place. And also I added a little bit of my experiences with essential oils when I talk about essential oils for eye health benefits. So it's a great episode, a lot of actionable tips and strategies you can gain from that episode. So episode 19. And with that, we're up to episode 20, which is today's episode, which is the recap. So I hope you enjoyed this kind of whirlwind tour through season 1 of the IQ podcast. I'm so excited to bring these episodes to you and these special guests to you, and to share my knowledge as well. With my solo episodes. I'm so curious about how you've been liking the IQ podcast and what you found to be most helpful. So I would love it if you could share in the comments below, which was your favorite episode? Which episode did you enjoy the most? Which one did you learn the most from? Which guest was most helpful? And because then if I can better understand kind of your perspective and your take on things, I can bring more and more high quality episodes to you. Now, in season 2 of the IQ podcast in 2025, I'm going to be doing things just a little bit differently. So instead of releasing an episode every week, which I've been doing this year, for the inaugural year, I am going to be releasing episodes every 2 weeks. So it's going to become a bi-weekly release, and it'll be the same format. Sometimes I'll do solo episodes with a slideshow and sharing my personal experiences and patient stories. Sometimes I'll invite a guest, whether it be an eye care expert or expert in a different field that can impact eye care, or sometimes I'll be sharing patient stories as well. Some of the topics I'm going to be covering include lifestyle medicine with Dr. Melissa Mandala, who is board certified in lifestyle medicine. So she's going to be talking about diet and lifestyle. I'm also doing a very short mini series on IIH, idiopathic intracranial hypertension, where I'm going to be sharing some of my experiences treating IIH, and also have another expert on, and also a patient who has IIH. So you'll be hearing their stories as well. And there is just so much else I'm going to be talking about: floaters and flashes and floaters. There's lots of great episodes coming your way. Also, natural vision correction, or natural vision improvement, I should say, and also vision therapy are on the schedule for 2025. So stay tuned for all that. But please, I would love to hear your comments and feedback, because I'm always looking to strive to do better to help serve you and what your needs are when it comes to your eye health and brain health. So please put some comments into the chat, and I do take them to heart. I really appreciate it. And also constructive criticism. I'm always open to constructive criticism. So I look forward to hearing from you. And again, thank you for joining me on the IQ podcast. It means so much to me that you tune in, that you're part of my community, and I hope to continue to bring you value as part of the IQ podcast. So I wish you all a happy end to 2024 and all the best for a prosperous and healthy 2025. Take care, everyone.